Welcome to Muslims and Mental Health with Sister Heather, a groundbreaking program looking at mental health issues through the biopsychosocial spiritual paradigm.
Hello and welcome to Muslims and Mental Health. Today we're going to discuss 15 steps to better sleep. March is National Awareness Month for sleep and the importance of sleep and sleep disorders. And so today we're going to discuss 15 ways that you can change your behavior that will lead to a better sleep. In the Islamic tradition, for the last 1400 years, there has been great discussion about sleep, the importance of sleep, how to sleep, dream interpretation, many facets of the sleep world. And in the last 100 and 150 years, what has been discovered in the field of psychology has been discussed for the last 1400 years in the Islamic tradition. And so today I'm going to highlight some steps that one can take when they're having trouble sleeping so that they may get better rest. If you have a sleep disorder, you're going to want to seek a physician's help in diagnosing and getting treatment for that. The steps I'm going to discuss with you today are more for people who are just having a little trouble sleeping, not exactly a actual sleep disorder. So if you have something that you think is at the level of a sleep disorder, you should consult your physician. But let's get started. I want to actually share with you, as I said, the Islamic tradition has a 1400-year-old tradition of discussing sleep and the importance of sleep. And the Prophet Muhammad, peace be upon him, said, and it's reported in Sahih al-Bukhari, that he told one of his companions, Ibn Amr, who was praying the whole night, that offer prayers and also sleep at night, as your body has a right on you. And so we see this throughout the collection of hadith, many hadith about sleep and the importance of sleep, and that it's important to have your worship and rituals, but it's important to also get sleep. And so one of the first things you can do to help yourself get better sleep is to reduce the following. You want to cut back on your nicotine consumption, your alcohol consumption, caffeine, and other stimulating substances. So caffeine, for example, you'll want to cut any consumption of it, whether it be through drinking or eating, 4 to 6 hours before bedtime to get optimal sleep. The second step would be to maintain a regular sleep cycle. In America, we have this phrase, early to bed, early to rise, and that's consistent with the Islamic tradition that encourages people to go to bed early and to rise early. And although it's not necessarily to have established that pattern where you go to bed early and rise early, it is important to establish a pattern that is consistent where you go to sleep every day at the same time and you awaken the same time. This will help you get your optimal sleep, as well as provide alertness and optimal work during the day. It's even more important that, let's say you go to sleep later than you would normally. That tends to be okay, the research shows, but what is most important is that you wake up the same time every day. So if you have a late day where you get off schedule, as long as you're still getting up at the same time, your pattern should stay on course. So you want to try to regiment yourself to a regular sleep cycle. The third step you can take to better sleep is to not nap during the day. Now, in many countries, it's very popular to have a siesta or a mid-afternoon nap. And you'll see this in many countries around the world. And although even in Islamic tradition, it's suggested that one take a nap in the afternoon, if you are someone who has trouble sleeping at night, you're not going to want to take that afternoon nap. If your physician recommends that you do so, then you should definitely follow your physician's recommendations. But if you are one of those people that has trouble getting to sleep, it's best that you not take a nap in the afternoon, unless your physician tells you to. A fourth step is to use your bed for only certain things. So you want to use your bed for sleeping and for sex, but you don't want to use your bed for contemplating life's events and world events, or your work, or reading or watching television. Now, some people can do these things and they get adequate sleep, but if you're a person that has trouble getting to sleep, the best thing to do is to not think about things in your bed, do work, read books, or watch television. And for a fifth step, you're going to want to look at your hygiene. What you do before you go to bed is going to have an effect on your sleep. So about an hour before you go to bed, you want to consider scheduling an hour before you go to bed to relax and unwind. You want to make that a regular part of your daily habits. And through that relaxation, there are a lot of different things you can do that are helpful to relax. And some of those can include mindfulness, breathing techniques, dhikr, like remembrance, and guided imagery. All these techniques can help you get into a more relaxed state before you go to sleep, which can then help you get a much better night's rest. The next step has to do with food. The types of food you eat and how and when you're eating will affect your quality of sleep. So you want to stop at least 1 hour before bedtime, although if you can stop 2 to 3 hours before bedtime, that would be good too. Sometimes if you have a light snack, like an hour before bedtime, that will actually help you sleep better if you're a person that has trouble sleeping. If you're a person that has trouble sleeping, you don't want to go to bed hungry. It's better to just have something light. You have to find a right balance in this because you don't want to eat a heavy meal before you go to sleep, because a heavy meal before you go to sleep can also be bad for you as well. So maybe just something light and just stop eating 2 to 3 hours before bed, but definitely 1 hour before you go to bed. Next, we have what to do if you try the steps that we've mentioned up to this point and you're still not able to go to sleep, and you're laying in bed and you're thinking, I really want to go to sleep, but I'm not getting there. So the best thing to do is to not just lay there and look at the ceiling or, try to ask yourself over and over again, when am I going to sleep? The best thing to do is to just get up, go to another room so that you have a different association with sleep, and do something that's not stimulating. So you're going to go to another room and maybe read something that will help relax you and put you to sleep. You can watch TV if it's not a stimulating type of show. You can meditate. Oftentimes, if you take a warm bath or a warm shower, that will relax your muscles and the tension in your body. Then it will help you to relax enough to go to sleep. So the idea is that you separate it out from your sleep space, so it's associated with another space in your environment, and you do something that is relaxing until you get tired enough that you fall asleep. And then there's always the other option. The next step that we're going to discuss is exercise. As you know, we have 2 different types of stress. One is called eustress, which is the good stress, that's EU stress, and distress, which is the negative stress that we're all familiar with. Exercise helps us have some of that eustress, some of that good stress, good for our bodies, releasing the endorphins and the good neurotransmitters. And so it's been shown in research, if you do some moderate exercise in the morning or if you do it before bed, and we're talking moderate, so nothing of high intensity, that can help relax your body enough to help you go to sleep. So again, it's just moderate exercise, but it can help you relax and go to sleep. Another behavioral technique to try, if you are a person who seems to have a lot of ideas running through their mind as they're getting ready to go to bed about what you want to achieve the next day, all the activities that you have for the week, is to keep a journal, something like this, next to your nightstand, or on your nightstand rather, and write down all the ideas in your head for the next day. So all the things you want to accomplish the next day or for the week, whatever is clouding your mind, write it all down, and then this way it literally gets out of your mind and onto the paper, and you're not habitually thinking about it, and it's there for you to the next day. So you can relieve yourself of the stress that I have all these things in my mind and I need to remember them. Well, you've remembered them, they're on a paper, and you'll get to them in the next day, but it should relax you enough that you can let go of that and relax and go to sleep. If all of those steps are not doing the trick to relax you enough to have a better night's rest, the next thing that I would suggest would be psychotherapy. Psychotherapy can assist you in identifying issues and other stress that's associated with your sleep disturbances. And the therapist can assist you with relaxation techniques and coping skills to help you get a better night's rest. Adjustments to your environment can also help. So wherever your designated sleep area is, you will want to adjust the environment accordingly for sleep. And so some of the ways we do that is to adjust the temperature in the room. So cooler is often better, but you don't want any extreme temperatures. So neither extremely cold nor extremely hot. You just want something that is temperate, something nice in between. At this time, we're going to take a short break, and when we come back, we're going to talk a little bit more about some of the adjustments that you can make to your environment.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
Welcome back to Muslims and Mental Health. Today we're discussing 15 steps to better sleep. As we took a break, we were discussing how to adjust the environment to create a better sleep environment. So I'd like to continue with that now and talk about how you need to adjust your lighting. You don't want to have too much lighting in your room because it will keep you alert and stimulate you. So we're looking at ways to adjust the environment so we have less stimulation. One thing that's often not realized by most people, on many of our technology, our phones, our printers, our computers, you'll see the little blue LED lights. And those lights actually are the part of their property is to stimulate. That blue light will stimulate you. So if you have even just a small one, say on your phone charger or something, that being in your environment will stimulate you in such a way that might keep you awake. So you want to make sure that not just your overhead lights, but little lights that you wouldn't normally think about, such as a charger light, that all those lights are dimmed or completely out. If you're very sensitive to light, you may want to invest in shades or curtains that really keep light out of your room and out of your space to create the best sleep environment. And in addition, you also want to adjust for the noise level. It's really important to have fewer noises in your environment to get the best sleep. Now, some people do not adjust well with complete silence. And if you're one of those people, you may want to get something that creates like a white noise. They have machines that create white noise, or you have radios that can provide white noise, and sometimes televisions create white noise, but then you have to worry about the light again. So you want to, if you need a little bit of noise, white noise is something that usually is noisy enough to give you a little bit of noise, but not too noisy to disrupt your sleep. So that's something to consider depending on how sensitive you are to noise level. Another step is if these sort of natural behavioral modifications don't work for you, and you go to see the psychotherapist and you're finding that you need a little bit more help, you could go see a psychiatrist and go the route of pharmacology. There are many options for sleep disorders and sleep disturbances of pharmacology that can assist in working with the behaviors and working with the therapist treatment to help you sleep better. And some of the drugs, I'm just going to mention some of the names to give you an awareness of what some of the names are, but I'm not going to go into a lot of detail here. We may look at that in a future segment, but not this one. So some of the drugs that you may have heard of before are Ambien, benzodiazepines, Nuvigil, Sonata, and there are many others like Lunesta. And so if you feel that you're having a lot of trouble getting to sleep, you may want to consult your physician, your therapist, a psychiatrist, and see what might work best for you to help you with your sleep disturbance. Another avenue would be holistic treatments. Now, holistic treatments are just that. They're holistic, and so they haven't received FDA approval. FDA approval being the Food and Drug Administration. Like with a lot of pharmacology, you have that approval, which means that the drugs have been tested, they've been tried, and so you have a sense of what the side effects will be. Of course, they vary from individual to individual, but at least you have a great idea of what the side effects might be. With holistic treatments, they're not required to have the testing. They're not required to provide the research that shows that it proves anything. And so you have to be very cautious when you use holistic treatments. Some of the very popular ones are kava, valerian root, and sometimes these can cause toxicity if you mix them with other things that you're taking. So I really want to give you a word of caution that these treatments do exist. They are on the market. They are an option, but you want to be very careful with them as they don't have any research backing them or protection for what side effects might actually occur. Another holistic treatment, however, apart from the medicinal ones, is hypnosis. Hypnosis has been used in a variety of settings, but it can be used to create a sedative state so that you can sleep better. And many therapists are trained in hypnosis, so again, that is something you could discuss with your psychotherapist to help you sleep better. And lastly, I want to discuss with you the spiritual part of the biopsychosocial spiritual paradigm when it comes to sleep. Some of the recommendations for Muslims particularly are that you read the Quran before you go to sleep. And there are 3 particular surahs, the last 3 surahs, that you should read before you go to sleep as a ritual, nightly ritual. And those 3 surahs are Ikhlas, Al-Falaq, and Al-Nas. This was a recommendation from the Prophet, peace be upon him, that people read these before they go to sleep as a protection in their sleep. Some other sleep manners that are tradition in the Islamic tradition, for those who may not be aware, is that the Prophet also mentioned making wudu, which is ablution, before going to sleep. And so this was recommended as a daily practice, and also that you clean whatever sleep area you have, whether it's a bed, a futon, if you sleep on the floor, whatever your sleep practice is, that you clean that area before you go to sleep. In addition, your sleep position is also considered a manner in Islamic tradition, and it's recommended that you sleep on your right side. Research has actually been done on this, and it has been shown that if you sleep on your right side, it's the most advantageous for your heart rhythm. So they've done several studies testing people sleeping on the right side, their left side, on their back, and they found what's most advantageous for the heart and the rhythm of the heart is to sleep on the right side. So these are 15 steps which you can consider to alter your behavior in such a way that will create the most optimal sleep pattern. And as we know, sleep is very important. So I hope this has been very helpful for you today. We look forward to any questions you have, comments, or feedback, and you can leave them at nafshealertherapy@gmail.com. That's NAFSHEALER therapy@gmail.com. And we look forward to hearing anything you have to say. Thank you.